Welcome to chapter 25, Poisoning and Overdoses from the EMT. So, poisoning. A poison is any substance that can harm the body. It can harm, it can, the harm it can cause can result in any kind of a medical emergency. Poison can be anything um, from medication to uh, chemicals to food to anything. So, medications, petroleum products, cosmetics, pesticides, plants, foods. I mean, it can literally be anything, and it can come from inhalation, injection, ingestion, absorption. Um, so, effects to the body. Um, so, is based on the nature of the poison, its concentration, the route of entry, patient's age, weight, and health. So, we could potentially, as an adult, take in um, something that wouldn't harm us necessarily, um, whereas a kid could take a little bit of it and it would harm them a lot more, or an older patient could take it and it would harm them as well because their body can't fight off those things. It can cause damage to the skin and tissues from contact and suffocation. And then it can also cause either localized or systemic damage to the body systems. It is classified by route, so ingested, inhaled, absorbed, or injected. So our own homes and squad buildings should be child-proofed against poisonings. And then we're just going to share poisoning prevention information with members of the public during school visits and community outreach programs. Um, for a kid, it may be accidental um, to eat or drink a toxic substance. For an adult, it's typically the medication, and it could be deliberate as well. So when we assess these patients, we're going to look at um, what the substance was that they took. We're going to get the exact spelling and transport to the patient to the hospital. We're going to ask when the exposure occurred. Um, Quick acting poison requires faster treatment, and ED personnel need to know for appropriate testing and treatment as well. We want to know how much was ingested. Um, you can estimate the missing pills by looking at the prescription bottle. So if they've got a 30-day supply and it's 10 days in and they've only got 5 left, we've got issues. Okay. So, and then we want to know over how long of a period did the ingesting occur. Um, so we want to know, has the patient been taking this on a regular basis? If it's a medication, um, or was this the very first time that they've been taking it? We want to know what interventions have been taken. Some people will take syrup of Ipecac to try and induce vomiting. Inducing vomiting is not a good idea, so we want to avoid that. Um, and then any kind of other home remedies that may have occurred. And then also, if it was like a chemical or something like that, it'll have some type of treatment on the label. We want to estimate the patient's weight or get a good weight on the patient. Most of the time, these treatments are related to weight and also um, how much they ingested is based on weight too. Um, yeah. So we also want to know what effects the patient has experienced. So nausea, vomiting, altered mental status, abdominal pain, diarrhea, any kind of chemical burns around the mouth, and any unusual breath odors. Food poisoning. This can be caused by improperly handled or prepared food. Typically, it's undercooked. Um, Symptoms include nausea, vomiting, abdominal cramps, diarrhea, and fever. Uh, this is one of those things that typically goes away on its own. Most people don't call for food poisoning. Occasionally they do. There's not a whole lot you can do except to treat the symptoms. Activated charcoal, this works through adsorption, allowing substances to attach to its surface. It is not an antidote, it just prevents or reduces the amount of poison absorbed by the body. Um, Many poisons, but not all, are absorbed by activated charcoal. Um, Typically, those volatile chemicals you can't use it on. Contraindications of activated charcoal include that the patient cannot swallow, they have an altered mental status, um, they ingested acids or alkalis, or gasoline. Those are all volatile chemicals. Traditionally, syrup ipecac was the preferred treatment for poisoning, and it induces vomiting in most people with one dose. However, it does have the potential to make the patient aspirate, and it also only removes less than 1/3 of the stomach contents. Dilution, so an adult patient should drink 1 or 2 glasses of water or milk. Um, Children should drink 1/2 to 1 full glass of water or milk. Water may slow the absorption, and milk may help to soothe the stomach upset. It's frequently advised for patients who, as determined by medical direction, do not need transport. So, we have this thing called the Poison Control Hotline. Um, it's in Missouri. We actually have 2 centers. So we have one in Kansas City and one in St. Louis, and it depends on where you are at in the lake area. Depends on which center you're going to get, because you could get St. Louis, you could get Kansas City. Just kind of depends on which one you get. But they're going to be your best resource for poisons, and they're going to give the um, direction to give. And they will actually tell the patient if they don't have any symptoms that are life threatening, then they really don't need to go to the hospital. And then they'll do a follow up as well if the patient decides to stay home. You can call poison control. Typically, what should happen, is that dispatch should get a hold of um, poison control first. So they should ask what the poison was, blah, blah, blah. And then they'll have a case number that they'll send to you, and then you can talk to poison control when you get to the patient contact, and kind of give them a better idea of what's going on. Or occasionally that doesn't happen, so you can just call poison control yourself and find out. We're going to detect and treat any kind of life-threatening problems, perform a secondary assessment, assess baseline vitals, consult med control or poison control, and then transport with substance information and perform that reassessment en route. Antidotes, thought of as a substance that will neutralize the poison or its effects. There are very few genuine antidotes. Narcan is not an antidote itself, but it does reverse narcotics' depressant effects on the level of consciousness and respiratory drive. Tylenol poisoning. This is a common cause of overdose. The toxic effects do not appear right away. They typically are 4 to 12 hours that include a loss of appetite, nausea, and vomiting. And then 1 to 2 days, they may have some right upper quadrant pain and jaundice. The antidote should be given within the first 12 hours. and there is an antidote for Tylenol, but it has to be given in hospital. Um, so, suspected Tylenol poisoning with any overdose. Search medicine cabinets and garbage cans for any kind of empty pill bottles. Deal with the apparent life threats first, and then treatment will be instituted at the hospital. Inhaled poisons, so carbon monoxide, chlorine gas, ammonia, agricultural chemicals such as pesticides, and carbon dioxide. Okay, so with these, we're gonna approach the scene with caution. We're gonna don protective clothing and SCBA if we have it. If you're not trained or equipped, call for additional resources. Here, we do not carry SCBA on our truck, so we can't go into those situations. So we have to call the fire department. Um, we want to know what substance was involved, the exact name, when did the exposure occur, how long, what interventions, did somebody remove the patient or did somebody ventilate the area, what effects is the patient experiencing as well. Carbon monoxide is a colorless, odorless, and tasteless gas. It can be caused by improper venting of wood burning stoves, furnaces, and generators. This is a common cause of death during natural disasters and power outages. Signs and symptoms include a headache, kind of like a feeling of a band around the head, dizziness, breathing difficulty, nausea, cyanosis, and altered mental status. If you have more than one patient complaining of the same things, you're probably looking at something that would affect everybody. So, carbon monoxide, carbon dioxide, all of those things. The patient may begin to feel better shortly after being removed from dangerous environment. We're just going to administer 100% O2, transport to the hospital, and it just takes time to wash out that CO2 or that CO from the bloodstream. We're going to move the patient from the unsafe environment using trained and equipped personnel. We're going to detect and treat any kind of immediate life-threatening problems in our primary assessment. We're going to perform a secondary assessment as well and obtain those vital signs. Administer high flow O2 if it is warranted and needed. Now, carbon monoxide has a higher affinity to hemoglobin. So if you suspect a carbon monoxide poisoning, then oxygen should really be given to these patients because of that higher affinity of the hemoglobin. So it will give you false readings on your pulse ox. So the patient may say that they have 100% oxygen, but that's because the carbon monoxide binds to that hemoglobin, and the pulse ox can't really make the difference between carbon monoxide and oxygen. It just says that there's something attached to the hemoglobin that is there, and so it can't necessarily make that difference. So transport all containers, bottles, and labels, and perform a reassessment en route. Smoke inhalation. This is associated with thermal burns, as well as effects of the irritants and chemical poisons within the smoke. Substances can burn the skin, irritate the eyes, injure the airway, and progress to respiratory or cardiac arrest. Signs and symptoms include difficulty breathing, coughing, smoky or chemical smell on the breath. They may also have some carbon residue in the mouth, nose, and sputum, and some singed nasal hair. Treatment includes moving the patient to a safe area, assessing the patient, maintaining an airway, and providing high flow O2. Maintaining an airway in these patients, if they have lots of smoke inhalation, may be difficult because the airway is going to start to swell up, and because it's trying to protect the lungs from getting any kind of smoke in there. So it's going to start to swell up, and then it's going to close off the airway. So it may be a little bit more difficult. So detergent suicides. This is a method of suicide started in Japan and becoming more common in the U.S. It's a mix of two easily obtained chemicals to release toxic hydrogen sulfide gas, and it's commonly released inside a closed space such as a car. You will see patients who have notes written on their windows that say that they were, not to open the doors, not to do anything because it's a hazmat scene. So, like this. So, scene safety. So, exposure to the fumes may injure EMS personnel, and a warning note may be left on the vehicle. But this is not an assured type of deal. And you may need to treat as a hazmat scene. Absorbed poisons can be absorbed through the skin. It may or may not cause damage to the skin, and it may or may not require decon prior to treatment. So direct and treat any kind of immediate life-threatening problems in the primary assessment. Perform your secondary assessment. Remove any kind of powder by brushing it off, and then irrigating with clean water for at least 20 minutes during transport. We're going to transport with all containers, bottles, safety data sheets, and labels from the substance, and perform a reassessment. Injected poisons, so these are most common. Excuse me. Most common are illicit drugs injected with a needle and venom of snakes and insects. And we'll talk about those later on. But excellent resource, Poison Control Centers, information on poisons and signs, symptoms, and treatments. And like I said, there's no reason that we can't contact them ourselves. So alcohol and substance abuse. Many patients have conditions that are caused either directly or indirectly by alcohol or substance abuse. Abuse of alcohol and other drugs crosses all geographic and economic boundaries. There is no rhyme or reason. People in Kansas City can do drugs just as well as people in Max Creek. And in affluent neighborhoods. So, alcohol abuse, so potent drug affects the central nervous system. Emergencies may result from recent consumption or years of abuse. We're going to treat patients with the same respect and dignity as any others. This abuse can lead to or worsen other medical conditions. Alcohol is often consumed with other drugs, which can result in a serious medical emergency. Impaired patients can be irrational or aggressive, and we're just going to contact law enforcement if there is a safety concern. So something to think about, can an alcohol impaired person give consent or refuse care? Technically no and yes. Okay, so it depends on whether or not they're alert and oriented and understand what is going on. It's not enough just to be alert and oriented. They need to understand what's going on as well. Okay. Many medical conditions mimic alcohol intoxication, like strokes, diabetics, hypoglycemia, hyperglycemia. All of those things can mimic alcohol intoxication. And those intoxicated patients may also have medical problems. Typically, some of them do, like pancreatitis or Hep C or cirrhosis of the liver, um, and when they drink, it inflames those things. So all patients should receive a full assessment regardless of suspicion of intoxication. Signs and symptoms of alcohol abuse include alcohol odor on the breath or clothing, swaying, unsteady feet, slurred or rambling speech, flushed, complaining of being warm, nausea, vomiting, poor coordination, slow reaction time, maybe some blurred vision, confusion, hallucinations. They can be visual or auditory, lack of memory, and altered mental status. Alcohol withdrawal. So this is an abrupt cessation of drinking, and may cause some alcoholics to suffer delirium tremens, or DTs. This can be serious, resulting in tremors, hallucinations, and seizures in that order. So signs and symptoms include confusion and restlessness, unusual behavior, hallucinations, gross tremor of the hands, profuse sweating, seizures, hypertension, and tachycardia. Vomiting is common, so standard precautions are essential. Stay alert for any kind of airway and respiratory problems, and assess for trauma. And then also be alert for any kind of changes in their mental status. Monitor vital signs, treat for shock, protect the patient from any kind of self-injury, stay alert for seizures, and transport. Substance abuse, so this is any chemical substance taken for other than therapeutic reasons. So this includes opioids, uppers, downers, hallucinogens, and any kind of volatile chemical. Okay, so opioids, this includes heroin, codeine, Oxycontin, Percocet, fentanyl, all of those things. It is used to relieve pain or cause a state of relaxation. So they're going to have a reduced rate of pulse. They're going to have decreased breathing, lowered skin temp, pinpoint pupils, relaxed muscles, profuse sweating. They may be sleepy, or they may even be in a coma. Uppers, cocaine, meth, these are stimulants that affect the nervous system. They may be snorted, smoked, or injected as well. Signs and symptoms of uppers are excitement, restlessness, increased pulse and breathing rates, rapid speech, dry mouth, dilated pupils, sweating. They may not have any kind of sleep for a long time, even possibly days. Downers, this affects the central nervous system as a depressant. It includes Rohypnol, GHB, benzos like Ativan, or the ADHD medicine, any of those things. Signs and symptoms include sluggishness, poor coordination, and decreased pulse and respiration. Hallucinogens, so LSD, PCP, ecstasy. These created an intense state of excitement and distorted perception. Signs and symptoms include a rapid pulse, dilated pupils, flushed face, and seeing or hearing things. Typically what these do, so they are a mix of an upper and a downer. So what will happen is they'll have this up state, and then they'll shortly after they'll have a down state, kind of coming down off of that medicine. Volatile chemicals, these produce vapors that are inhaled, initial rush, and then acts as a central nervous depressant. Signs and symptoms include dazed, loss of contact with reality, may develop into a coma, swollen membranes in the mouth and nose, feeling funny, numb feeling or tingling inside the head, and they may also have changes in heart rhythm. And this includes whippets, so like the canned whipped cream, anything canned, compressed, canned air. It can also include rubber cement as well. Patient assessment may be difficult. Signs and symptoms vary from patient to patient. The patient may have taken more than one type of drug, and signs and symptoms are similar to other medical emergencies. So we're just going to begin by asking the patient if they've taken any medications and then ask about drugs. Signs and symptoms of drug withdrawal include shaking, anxiety, nausea, confusion and irritability, hallucinations, visual or auditory, profuse sweating, increased pulse, and breathing rates as well.